My name is Igor Chirikov. I'm a senior researcher and SERU Consortium director at the Center for Studies in Higher Education. And so as a consortium director, I'm responsible for coordinating SERU North American division and SERU International divisions, and also for directing SERU research and development priorities and other projects. So, and my research is closely related. This is student experience, learning outcomes, and specifically, I focus on kind of the impact of technology on universities, including online learning. I started before the pandemic, and the pandemic obviously provided much more food for thought than ever before. And also, I'm interested in international kind of a comparison, international comparative higher ed. Krista?
Everyone, I'm Krista Soria. I use she, her pronouns. I work at the University of Minnesota as the Director of Student Affairs Assessment. I also have a position with the SERU Consortium as the Assistant Director for Research and Strategic Partnerships. And then I also work with the Institutional Research Office on our campus as well. I have been affiliated with SERU since 2010 when I began working at the University of Minnesota, which is also where I received my PhD in higher education. I used to administer the SERU on our campus, and now I mostly help with administering the grad SERU on our campus. And I have a lot of research interests. My CV is nuts, but I would say probably 3/4 of my research is based on SERU. And I look at things like students' participation in community service and service learning, their leadership development, high impact practices. I really focus on the experiences of marginalized and underrepresented college students. I have lots of research buckets. And of course, a new bucket now is the impact of COVID-19 on undergraduate, graduate, and professional students. So thanks for having me here today, everyone.
Great. Thank you for speaking.
Yeah, I'll share the screen so we can start. Thanks for having us today. We are delighted to share our research with this group, and I value this group a lot and very happy to be a part of it. Thanks, Anne, for organizing this and bringing us all together before COVID and during COVID, and hopefully after it as well. Here's an outline of today's presentation. Since we have former CSA Chief Visiting Scholars from different countries as part of this group, we will first provide kind of a little bit of context, what's going on in the United States and what was the impact of COVID-19 on colleges here in the US, and some kind of most recent developments, just a brief overview, and then I say a few words about SERU Consortium for those who are kind of new and doesn't know much about SERU, and also we'll kind of say a few words about our sample and who are the students in our survey. And after that, we'll explore kind of two broad domains of student experience during the pandemic. First, Krista will share the insights on the impact of COVID-19 on student mental health, safety, food and housing insecurity. And then I will talk about student learning and adaptation to online instruction. So Krista will need to leave at the end of the hour. So I suggest we stop for questions and comments after her part, because I think it's organically would be nice to do. And then continue to kind of a second part with the remote instruction. That sounds good, Anne?
Of course, it sounds great.
Sure. So let me start by providing a little bit of context in terms of the impact of COVID-19 pandemic at the universities here in the US. So when the pandemic hit, most universities, they closed their campuses early on. In some states early March, and it was way before the national emergency was declared. So similar to universities in other countries, I'm not sure about New Zealand though, because it's a whole different story probably in New Zealand and COVID. So universities quickly moved instruction and services online, sent students home from campuses. And for the most part, the rest of the spring term was online everywhere in the US. And this transition was a great shock for university administrators, for students, for academic staff, for everyone. And very few universities, honestly, were ready for this big transition, and most developed their plans kind of on the go. So, and in addition to that, chaos that the pandemic brought, it brought significant financial stress, especially on small colleges and universities. And we had a panel at CSHE about specifically that. Um, so there are more than a dozen schools that already permanently closed, and some predict many more like will follow. Some apocalyptic scenarios. We have hundreds of kind of a small colleges closing down. Hopefully, they will not. They will not. And after this kind of initial shock, and transition to remote learning, campuses started planning for fall, obviously, and there was a great deal of uncertainty in spring. By the way, if you remember, nobody knew how colleges would operate and how they move forward to and reopen safely. And so some universities announced they would stay online. Like CSU system, for example, was one of the first, I think, large campus systems that announced, and some actually stayed hybrid or mostly in person because they feared that if they would not reopen, they would lose students. Actually, when we did the survey, the SERU COVID-19 survey that we'll discuss today, uh, we analyzed preliminary results in June, and one of our first kind of a policy briefs was on whether students will re-enroll in the fall at research universities. And actually, I'm really happy right now that our predictions back then were quite accurate. So uh, we saw that at four-year colleges, the decrease the decrease in enrollment was not that large, around 2%. So students kind of continued their study, and we predicted kind of more than 90%. So that's close, I think. So because back then a lot of people just thought that half of students wouldn't just show up next year. So universities explored kind of a lot of different models how to reopen. All of those plans, they emphasize testing, social distancing, masks, using online modality for large classes, most of the discussion sections, even if students are on campus. But when campuses first started to reopen, college towns, they got huge spikes in the number of cases. And on the left of the slide, I took a picture of Iowa City before the semester began at the University of Iowa. And you can see that students don't necessarily follow uh, the rules and behave the way university administrators expect them to behave. So immediately, a lot of universities, they face sharp increases in COVID-19 cases, and some reverse their plans, but some actually not. Um, so just the last part in the context of this presentation. So the chart on the left is the comparison of COVID-19 cases in counties with college towns and without college towns. It was made by New York Times, and you see that in mid-August, college towns saw a big increase in cases, while in other counties the number of cases actually decreased. So, and on the right side of the map, on the right side, it's the map of COVID-19 cases at colleges from about 3 months ago. And you see some universities continue to have kind of hundreds of cases. In fact, while we talking, there is a huge spike at Berkeley right now. I'm not sure about the University of Minnesota, but Berkeley last week reported almost 200 cases, and it's the highest number that we've seen during the pandemic. And I believe, if I remember it correctly, two of them were of the UK variant, which is highly contagious. I don't know, Krista, is that the same? What's it like at the University of Minnesota right now?
Yeah, I was just going to chat that we had a similar situation with our freshmen, like the University of Iowa one. At one point, our entire football team contracted COVID. And so here's the news article about our freshmen partying during the first week of school. Not a proud moment. Right now, though, things seem to be pretty stable and pretty low.
Yeah. So it's different, but I think New York Times, they actually, in addition to the number of cases, they trace cases at college campuses. I checked it out yesterday. The update was from December, so it's not very up to date, but it's 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 very so people worry how colleges would reopen and how it would affect the spread of coronavirus. So this is where we are. And before we jump to the results, I would like to say a few words about SERU Consortium. Again, especially for those who are new to the group and to the project. So SERU stands for Student Experience in the Research University. It is a member-run, non-for-profit consortium of research-intensive universities. So our members, they regularly administer both undergraduate and graduate student surveys, and then they share the data for benchmarking, academic program review, policy evaluation, campus improvement. And of the past kind of 10 years of operation, um, we've collected data on actually more than 1 million students studying at research intensive university, and this data is used widely for research and policy analysis. And as Krista mentioned, Krista is the champion in terms of publishing from SERU data, and it's amazing how many studies she published, and it's very always a very interesting read. Um, so the consortium is a collaboration of Center for Studies in Higher Education here at Berkeley, the University of Minnesota, and a UK-based survey company called iGraduate, and also all the member institutions participate in that. So here's the little bit outdated kind of a list of SERU Consortium members over the past 4 years. It has two divisions, North American division that includes US and Canada, and also international division that includes universities from different countries. Over the past few years, we have 31 member in the North American division and 13 members in international division. In the North American division, most universities are AAU institutions, the members of Association of American Universities, and a few that are one institutions that are not non-AAU members. And internationally, we invite kind of universities of similar standing. So now to the COVID survey. Usually we run surveys in spring, kind of starting late March, and we were actually ready to run all the surveys before everything started. So most institutions, they obviously canceled their regular surveys this spring, and we all collaborated to develop an alternative survey in a very short time frame. This survey included 5 topical areas that at the time reflected kind of a primary concerns of SERU member institutions during the pandemic. These are student academic experiences and transition to remote instruction, personal and family financial hardships, student health, well-being and safety, student belonging and engagement in volunteering, and education and career plans. So as you see, there are like 5 areas. And we also, in addition to that, we collect an extensive demographic section and combine survey data with the student level data from administrative records. So it's a huge data set. And we only today, I kind of we'll explore only 2 of them of the 5, but there's much more than we'll present, obviously. So this was kind of an online survey, and you need to we need to understand that during the pandemic, not all students, they had stable access to computer and the internet. So when we created the survey, we tried to make it short, especially by SERU standards, and SERU surveys are usually long. Roughly 2/3 of students, they completed the survey from their mobile devices, And completion rate was actually pretty good. It was over 90%. Those 90% who started, they finished the survey. And we also try to make the survey actionable, cost effective, allow benchmarking across SERU member institutions. So the project is, um, um, the goal of the project is to support universities in their kind of a decision making and also make research of that data as well. All the participating institutions, after the data collection, they got access to interactive Tableau dashboards that were developed that in kind of a were able to instantly inform different stakeholders on the campus about the results. And again, Krista posted. I'm not sure if everyone, especially who joined later, maybe don't see it. Krista, can you repost the link to the policy brief that we published from the results? Includes the results on first generation students, student caregivers, student mental health, and the link is in chat. So the survey was a census survey, meaning all students were invited to participate at 9 public research intensive universities from mid-May to mid-July. The response rate varied from one institution to another, from 13% to 24%. And in total, for undergrad, we collected over 34,000 responses. In addition to the undergraduate survey, we also collected data from more than 17,000 graduate professional students. There are also policy briefs from that data, but we won't report any results today. We also ran the same survey at 15 different international institutions, mostly SERU members, but some not, in China, New Zealand, Russia, Kazakhstan, India, Japan, and also Brazil. And our goal for the first half a year is to also provide an international comparative perspective. And it's not that easy to combine all those data sets, obviously. So as I said, our sample includes over 34,000 students. As you see from the slide, it's quite diverse student body. Less than 2/3 are cisgender women, and it's slightly more compared to students' school general population, and we see that in other surveys as well. 1% are non-binary students, 1% transgender students, around 20% of the sample are students of color, 9% international students, 25% first generation students, 23% are low income and working class students. And also what's important in the context of the pandemic is that the data that most, this is the data that most schools do not collect at the institutional level. Almost 6% of students, they actually cared for children. And this includes both their dependents and also siblings, because a lot of students, they moved in with their families and they were primary kind of a caregivers. And almost 11% care for adults and around 3% care for both children and other adults during the pandemic. So now finally to the results. And first, Krista will share. I'll probably need to stop sharing my screen. Krista will share the results on student well-being and safety, and then we stop for questions and comments, and then we'll talk about obstacles and positive experience with remote instruction. Please note that these are kind of a mostly descriptive findings, but we are working on a few in-depth papers in both of these areas. And actually, I don't know, Krista, is yours on mental health already published?
It will be in
It will be, yeah.
What issue? The March-April issue of the Journal of College Student Development. So I pulled it up so you could take a look at it. And so we used a more sophisticated analysis where we were controlling for the effects of other variables. So I've just was sort of showing that here for folks if you're interested, but it should be published in the next couple of months. And thanks, Igor, for starting us off with such a fantastic presentation. You're kind of a hard act to follow because you're such a wonderful presenter. So thanks everybody for having me here today. A couple of the items that we asked students related to the presence of their clinically significant mental health disorders, both major depressive disorder, and we found that the prevalence was 35% among our undergraduates. We asked 2 questions from a well-known and validated screener called the PHQ-2. And so again, 35% of our students had clinically significant symptoms for major depressive disorder. We also saw a lot of variation by students' demographics, and these are outlined much more in, we've got three policy reports really about mental health or emotional or mental health concerns. And so I know that this is a little small and challenging to read, but for instance, again, that sample, the average was 35%. But we found that non-binary students, 65%, had clinically significant symptoms of major depressive disorder. Transgender students, 63% had clinically significant symptoms for major depressive disorder. 62% of queer students had those clinically significant symptoms. Half of low income or poor and 42% of working class students also had those symptoms. We also see a lot of variation by race and ethnicity. So one group in which the clinically significant symptoms for major depressive disorder were particularly high was American Indian or Alaska Native students, and so on. So, and caregivers as well experience much higher rates of those clinically significant symptoms compared to their peers. And again, we've outlined some of that a little bit more in one of our policy reports in particular. And my apologies, but I have to leave at 3 o'clock, which is why I'm rushing through these things, because I have to go teach a stats class at 3. So my apologies.
Krista, there's a quick question in chat. How different are these numbers from pre-COVID times?
Oh, that's a great question. I actually wrote about it in the paper. And so some of the most recent estimates were a lot lower. And so around the 20% range or so. Although Igor and I talk informally about the impact of the pandemic, of course, we're not able to, to actually gauge statistically the impact of the pandemic. But what we can say for certain is that pre-pandemic and current pandemic rates of mental health disorder are different, with students experiencing more mental health disorder symptoms during the pandemic than before the pandemic. Although we have not asked these questions of SERU respondents in the past, we do know that that's true in our graduate and professional students because we do have pre and post pandemic gauges on their mental health. But other national surveys of mental health, like the Healthy Minds survey, for instance, and lots of other groups, they've also reported increases in students' mental health disorders during the pandemic as well. So next, using the GAD-2, again, another well-known validated instrument for clinically significant symptoms of generalized anxiety disorder, we found that 39% of our undergraduates were at risk. They were experiencing those clinically significant symptoms for generalized anxiety disorder. And again, we see differences by demographics. So for instance, 54% of low income or poor students had these clinically significant symptoms, 47% of working class students. I wrote my dissertation on social class, and so I could talk about social class all day long. Greg and I could just go on and on about social class, I'm sure. But those are very alarming and very concerning. Additionally, almost 3/4 of non-binary students have these clinically significant symptoms of generalized anxiety disorder. 2/3 of trans students also had these clinically significant symptoms. Queer students, pansexual students, caregivers, they were all more likely to experience these clinically significant symptoms for generalized anxiety disorder as well. We also asked questions about student safety during the pandemic. So about 3/4 of the students in our sample indicated that they relocated during the pandemic. Of course, many students had already lived in apartments around their campuses, so they weren't necessarily required to relocate, but a healthy number of our group relocated during the pandemic, whether that was to another residence in the same city, in the same state, in the country, or whether they had to relocate to a different country. And there's always been sort of an underlying concern about whether that relocation might have sent students to places where they didn't have the same type of potential protective factors that colleges and universities have for students, especially with regards to students' safety and identity and respect for their identity. So what we found, so we asked students to indicate whether the statements were often true, sometimes true, or never true. And about 15% of students said it was either never true or sometimes true, that they had a place to live free from physical or emotional abuse. looks like 10% said it was never true or only sometimes true. They had a place to live free from drug and alcohol abuse. 11% said it was never true or sometimes true that they had a place where their identity was respected. And 13% said it was never true or sometimes true that they had a place to live where they felt safe and protected. And so, between 10 to 15% of our students were living in environments during the pandemic that might have compromised their overall safety and well-being. And again, we see demographic differences between students. So the average, again, of the students who said it was never true or only sometimes true that they had a place to live that was free from physical or emotional abuse or violence. As you can see, there's drastic differences. So close to 40% of non-binary students said it was never true or sometimes true that they had a place to live free from physical or emotional violence or abuse. About a third of transgender students, a third of caregivers. And so we can definitely see some stark differences in students in demographic groups based on those who said they weren't necessarily living in these safe places. The same is also true for living in a place free from drugs and or alcohol abuse. Not as drastic as the previous item, but again, about a quarter of non-binary students said that it was never true or only sometimes true that they had a place to live that was free from drug or alcohol abuse. Caregivers also had challenges, as did folks who experienced, who have disabilities as well. Having a place to live where their identity was respected. Here we see really alarming differences. Non-binary, transgender, queer, gay or lesbian, pansexual, bisexual students. Those students were 3 to sometimes 4 and 5 times more likely to say it was never true or only sometimes true that they lived in a place where their identity was respected. And so very alarming safety situations for those students. And then finally, having a place to live where they felt safe and protected. Again, non-binary, transgender, pansexual students, caregiver students with disabilities, much more likely to say it was never true or only sometimes true that they had a place to live where they felt safe and protected. The last 2 topics are food insecurity and housing insecurity. So for food insecurity, we used a validated measure, a 2-item screener for food insecurity. And we analyzed those data, and what we found was that the average was that about 22% of students in our sample experienced food insecurity during the pandemic. Now, compared to national averages, if you look at the work conducted by the Hope Center, they typically find that around 40% of students, and that's public 4-year students, community college students, but about average across the nation, it's about 40% of students who experience food insecurity. So overall, our group was less likely to experience food insecurity. But if you look at our sample, we also have a lot of middle and upper class students in our sample. And so the students who attend our research universities are definitely different than students who might attend regional institutions or community colleges, especially with regards to their social class. But still 22% is no, a small number, right? That means, close to a quarter of our students are experiencing some type of food insecurity during the pandemic. And again, with the demographic differences, right? So close to 60% of low income or poor students experience food insecurity. 50% of those who cared for both children and adults experience food insecurity, 40% of working class students, and so on. So again, there are some pretty big differences based on demographics. We did not use a traditional measure of housing insecurity. Instead, we created these items and modeled them after the food insecurity items. But what we found is that 37% of our students experienced housing insecurity during the pandemic. And again, much higher for folks based on their social class, caregiving status, and race ethnicity, and also for a parental generation. And I was reminded, Igor, we had first gen on this slide twice. I forgot to ask to change it, but that was my fault, by the way, not Igor's. But close to 3/4 of low income or poor students experienced housing insecurity during the pandemic. Over 2/3 cared for both children of caregivers for children and adults experienced housing insecurity. So this is definitely a pretty critical issue, I think, for institutions to address during the pandemic. I won't go through all of these, but in each of our policy briefs, we provide recommendations for institutional leaders, staff, and faculty to consider to support students based on their safety and mental health. So, for instance, focusing on prevention, making mental health everyone's responsibility. I will say, though, and fairly so, I believe the national narrative has shifted to not just we need to take care of students' mental health, but what about the mental health of staff, and what about the mental health of faculty who are equally stressed and overworked and experiencing significant challenges during the pandemic. So when we were writing these, we were very focused on here's what institutional folks should do. Now I might, put on the brakes a little bit and say, we're all stressed. We're all very tired. What can we do to support each other through these challenges? I'll just share anecdotally, when it comes to food and housing insecurity, over the Thanksgiving holiday, I teach a lot of classes at a lot of different colleges and universities, mostly in the Twin Cities area. But I offered to cook a Thanksgiving meal for my undergraduate and graduate and professional students in my classes. And a few of them took me up on it. And so I was really happy. I drove around and delivered meals to my students who could really benefit from a little extra nutritional support, especially during a holiday where many of them also felt that social isolation and that disconnection from loved ones, from family, from friends, the type of experiences that they would have had on their campuses but couldn't any longer. But of course, expanding food pantries is another part of our recommendation. At the University of Minnesota, we actually had a food delivery program. So for students who lived around campus within a certain mile radius, our food pantry volunteers would deliver food for those students so they wouldn't necessarily have to come to campus and potentially expose themselves to the virus. And we have some other, additional ideas posted here. But I will turn it back over to Igor and probably excuse myself in a few moments to go and teach my class. So thanks so much, everyone.
Thank you
Yeah,
very much.
maybe we'll stop here for a second, and maybe there are like any questions or comments. I think if you have a few minutes, Krista.
Sure. Mm-hmm.
Was DACA a category? DACA students?
No, I don't think we have that in the data set. Responded in chat.
No, we didn't ask students that information. I think it would be the type of information where we might not have students answer necessarily. So we have an immigrant climate question, like what's the campus climate for students of your immigrant background on the SERU? And that is a big area of drop off from the survey for us. So I would be nervous to ask that question, but no, we did not ask that question.
Krista, I have one question. If it's true that, as you point out, that only 13 to 24% of the students responded to the survey, is it possible that the survey results greatly underestimate the negative impact of the pandemic, with the assumption that maybe the students that are most depressed, most overwhelmed, most financially strapped, et cetera, were significantly less likely to answer the survey?
Or the opposite, that those who were most impacted were like, listen, I have a story to tell you, right? And so, yeah, so either way, and this entire time through the pandemic, I'm involved in a lot of surveys on campus, and I keep going back to the ethics of asking students for more information during this time, especially from underrepresented and marginalized students, like keep hammering them with like, give us more, and granted, without the data, we can't help decision makers and policymakers to make informed decisions. But that's a persistent question that's always been gnawing at me. Another challenge is that we administer these surveys in the summer. And that's kind of unprecedented for most SERU institutions. We traditionally administer in spring from, sometimes late February to June, but we did it from May to July. And so consequently, I think we're missing students who are just like, I'm done. This was a tough semester. Like, I'm not answering my email until September 1st or whatever that might have been for them. And so I think that was an additional challenge. Some
Right.
institutions were not able to offer incentives. And so it was real. I think it was a challenging time in terms of data collection that absolutely could have affected the outcomes that we received.
Just a follow-up, real specific question, going back to your comment about social class. Um, can you check and see whether, in fact, middle class or students were more likely to answer the survey than working class or lower income?
You know, they're definitely very well represented in our sample. What's challenging is that like institutions often don't keep their own measure of social class necessarily. One thing that I have found though, with my own research, comparing FAFSA, estimated family contribution, and then adjusted gross income, is students are pretty good about their social class.
Sure.
There's clear, like, you know, in some cases, $20,000 to $30,000 income differences by each social class, comparing them to FAFSA. Now that's the type of research I don't think any of us could conduct any longer given new federal financial aid rules and regulations, but you know, in like 2010, I could do that work. And so they're pretty good at it, but you know, what I tend to find on my campus is pretty consistent about, you know, and I'm thinking about working class. I don't remember low income or poor,
Right.
but about 20% of my students consistently at the University of Minnesota identify as working class. And that's been consistent since 2010. And actually it's gone down maybe like a little bit over time. We have also, and you all know this story, but at the University of Minnesota, we've also gotten more rigorous in terms of ACT score admissions requirements, and that has also meant a decrease in the number of students from low income or poor backgrounds, which is not a surprise, right? But yet our students are more successful. I wonder why. ACT or income, right?
Right.
You all know that story.
Right. Krista, final comment before you have to leave. I probably speak for a number of us. I think you're too modest in terms of suggesting that Igor is such a superior presenter to you. You're both great presenters. Thanks.
Well said, Greg.
Thanks, Greg. I'm gonna give you a little heart. Thanks, Greg.
I agree, and we also, Greg, I think it's a good comment about kind of biases in a survey response. But I think if you compare our results with other studies like Healthy Minds and others, I think we're in the ballpark of what others are estimating in terms of the mental health crisis on campuses. So it's not like we are much lower than others. I think maybe for some estimates are even higher. And there's also a good question from Amal, like if we were able to disaggregate by week. We actually did that for the mental health policy brief to check if George Floyd killing was kind of a factor in the mental health crisis, but actually it was not. So there is no big variation from the week of survey response, like from the week when student responded in terms of anxiety and depression. It's pretty stable, which is actually quite worrisome because you would expect that especially those students who finish their classes, they would have been kind of a less stressed, but we don't see that in the data. It's really stable over the weeks.
Interesting.
Any other questions or comments? And I agree that Krista, you are an excellent presenter, and so.
Well, I'll answer quickly Rachel's question. We did not ask a follow-up question about accessing counseling or coaching. However, that is a question on the grad SERU. So we asked students, are you currently receiving treatment? And then do you know where to go for treatment? And so as the undergrad SERU starts expanding some of the mental health items, those might be some great ones to include as well, but they're currently on the grad SERU. They were not asked as a part of the COVID-19 survey. So that's a great question.
Yes, we were trying to kind of be brief and touch different areas, but not to go into like a lot of details. Good question about grad trends. They are pretty similar. And if you look at the policy brief on student mental health, there is a comparison between undergrad and grads. Especially, I think what Krista mentioned is that for grads here, we have a comparison from before the pandemic. And you see like there is an increase, twice as much students report anxiety and depression. a good way to advertise our policy brief.
No other questions, it seems, for Krista?
Yeah,
Thanks
thank
for
you, Krista, for joining us. Good luck with your class, and appreciate for joining us today.
Thanks so much for having me, everybody. And I would be happy to come back at any time. You're all just amazing people, and I look up to you a lot. So thanks so much. Be well. Take care.
Thank
Bye-bye.
you.
Yeah.
Well yourself.
Yes, and so let me go to the second to turn to the second part of the presentation, and this is kind of an area that I'm most interested in. Obstacles and positive experiences with the remote instruction. To some extent, this transition to online was a big experiment for colleges and universities, and I was interested how students experience that. We have a few kind of a follow-up questions about this this spring. We collect data from 11 universities this spring, so it will be interesting to see what are the trends. But now I'll be talking about spring semester only. So slightly less than 2/3 of students, they report that they are satisfied. They were satisfied with the quality of their courses that were taught remotely. Even more, there's 81% of students who were satisfied with the support they received from the instructors. And I think the work of instructors was the kind of the best that happened with students during the pandemic, because in the open-ended questions, students actually wrote a lot of nice things about the instructors, who a lot of them, they went beyond their kind of a direct teaching responsibilities to support students. Like Krista just mentioned what she did as an instructor, which is amazing. And some students reported that some instructors, they bought food for them, they checked in on them, try to help. But at the same time, this kind of despite this, the support of instructors, only half of students reported that they adapted well or very well to online to remote instruction. And here's the list of obstacles to a successful transition to remote instruction that students reported in the survey. So as you can see in this chart, only 4% of students told us they didn't have any obstacles in their transition. Only 4%, which means that 96% they actually had one or more obstacle. The most common obstacles are the lack of motivation for online learning, the lack of interaction with other students, inability to learn effectively in an online format, and the lack of access to appropriate study space. And so more than half, in general, more than half of students encounter one or more of these obstacles. Other important obstacles, they relate to kind of to the course content and expectations, availability of instructors. But I think this is kind of the most worrisome finding from our survey, is that there are significant disparities in terms of how students adapted to remote instruction. It was reported in the media. We just have kind of the data to support that. So overall, in our sample, 51% of students indicated they adapted well or very well to online instruction. But if you look at at Black students, at Latinx students, low income, working class students, this percentage is significantly lower. It's also lower for first generation students, for LGBTQ plus students, transgender, non-binary students, students with disabilities, students who were caregivers during the pandemic. We have the you see the numbers on the slide. So since social class was discussed and by Krista and by Greg in more details, let's look at the disparities by social class in more details. And we see that students from poor and wealthy families, they experience somewhat different obstacles in their transition to remote instruction. So look at the first four obstacles highlighted with the red rectangle. So the difference in the share of students who experience these obstacles between low income and wealthy students is around 10 percentage points or even more. 70% of low-income students, they reported that they did not have access to an appropriate study space or had distracting home environment, in contrast to only 48 wealthy students, 48% of wealthy students. Low-income students were also much more likely to struggle with attending classes at their scheduled time, didn't have access to technology, computer or proper internet connection, also struggled with the inability to access learning support services. But at the same time, so these are kind of the obstacles where there are big differences by social class. But at the same time, for some obstacles, there's no difference by social class. For example, in terms of access to instructors or motivation for online learning. Motivation is a big factor, kind of works equally for all. Another important characteristics that there's a lot of variation in terms of how students transition to online instruction by major or field of study. So this chart, let me explain this chart a little bit. The dots on this chart are 2-digit CIP codes that are used to indicate kind of a broad academic programs in the US. These are kind of fields of study. The horizontal axis is the percentage of students who indicated that the course content, that the courses that we're taking, that it was not appropriate for online learning as an obstacle for the successful transition. So the more on the right of this axis, the harder it was to adapt the course content from student perspective. And the vertical axis is the percentage of students who adapted well or very well to online instruction that reported in general. So the higher on the scale, the better students in particular major adapted. And you see these 4 quadrants divided by red lines. Red lines indicate the averages on each axis. And you see that, for example, for education, for engineering and architecture students, they felt that the content was hard to be transferred online, but despite that, students kind of adapted well. On the contrast, in physical sciences and chemistry is a big part of it, and also visual and performing arts students, they did not adapt well. And it looks like it was a bit easier to adapt for students majors in mathematics. So the big winners are students in mathematics, computer sciences, business, and management. The course content was easy to adapt, and students kind of adapted well. And the most challenging areas, and we see that also in other kind of factors like mental health, the biggest challenges were for students who are majoring in area, ethnic, cultural, and gender studies, languages, and literature. So these are kind of a consistently report that they have more challenges, not only in instruction, in learning, but also in other areas. Not only something, let me say something positive as well. So students also reported some positive experiences with the remote instruction, but of course in a much lower rate than they reported obstacles. So some students, they had more time for their studies, felt less stress, and were able to prepare more for their classes, felt more comfortable participating in class discussions. But again, 27%, they didn't have any positive experiences associated with the remote learning. And one of the, I think, biggest groups that benefited, those that needed to commute. Like we had an open-ended responses. We had quotes from students who told, like, my sleeping schedule improved tremendously because I didn't need to commute 1.5 hours to campus and back and like worry for parking. So there were some benefits as well. But one of the, I think, more surprising results actually for me, that there is also disparities with positive experiences with online learning. So not only obstacles, but also disparities. It's a little bit kind of a more complicated. So I just expected that students from low-income families would just report less positive experiences for them. But I was actually proven wrong. It is true. For example, look at the first item in this chart. I felt less stress about my studies. We see that 28% of low-income students, they indicated this is a positive experience in comparison with 41% of wealthy students. So there is kind of a big disparity here. But low-income students, they actually more frequently reported that what they liked about the remote instruction is that they felt more comfortable participating in class discussions online compared to wealthy students. There is a kind of if you do regression, there is a statistically significant correlation between social class and positive experiences participating in class discussion. Even if you control for like additional covariates, gender, race, ethnicity, age, parental educational field of study. In addition to low-income students, female students also reported that more often as a positive experience, and also student parents. So I think it's an interesting kind of a finding from the data, and we're definitely going to explore that further. But I think what actually help the students to participate is that in online environment, and Zoom is a big component of it, there are two ways of participating in a discussion. There is a video kind of a part of it, and there's also a chat when you can post, you can think about it, you can think what you want to say, you can kind of prepare yourself, and it's slightly easier to participate in a discussion online than in person. And so I am thinking what it means for schools reopening as well, that some components of online experiences probably would be missed. And I think chat function, it would be one of them. And I think it's kind of an important topic to discuss and to and maybe today actually. So I would appreciate your kind of insights and interpretations and maybe other research that could follow. And just last topic that I wanted to cover today is I'm interested in the relation between the transition to remote instruction and previous student experience with online courses, whether this previous experiences actually helped them to adapt to remote instruction when it was introduced. So in some kind of papers consider online learning as a transferable skill that can include kind of a time management, self-regulations, and other aspects that can be developed over time. And understanding how online learning works can actually help campuses to make decisions about online modality in the future, even beyond kind of after the pandemic. And hope that also those colleges that are still operating online or will operate online because of different reasons, like for Berkeley, for example, important factors even after the pandemics are fires. Like when there is a fire season, there is sometimes no electricity, and it's important to have to kind of to improve instructional resilience, how they call it. So in our sample, we actually had a quite big number of students who took different types of online courses in the past. 45% took courses for credit at their university, 16% took courses at other institutions, and 3% took other online courses. So overall, more than half of students took at least one type of online courses in the past. And I would say that a lot of them are transfer students. So transfer students took online courses at a much higher rate than freshmen. So here actually results from a simple binary logistic regression where, so we try to identify the relationship between the pre-pandemic experience in taking online courses, different type of courses, and successful adaptation to online learning. And so adaptation was kind of our dependent variable. And as you can see from these results, those students who took online courses prior to the COVID-19 pandemic, they had 1.1 times the odds of successfully adapting to remote instruction than those who did not take online courses. It's not a lot, but it's still a statistically significant result, which holds in 5 different models, whether we control for student demographics, socioeconomic background, like social class, parental education, caregiving responsibilities, field of study, student status. We also have GPA in addition to that. So in general, these results, they kind of give us hope that students with um, who get experience of online learning, they will be kind of a more successful learning learning online. So to summarize, and I would appreciate your input and comments and questions. We see big disparities in transition to online instruction. Institutions definitely need to work with academic staff with the develop targeted accommodations for, especially for caregivers, for low-income and poor students, students with disabilities, and this can include kind of recording lectures. Expanding asynchronous delivery, expanding hours for learning support services, or in terms of kind of a teaching and learning, using trauma-informed pedagogies and recognize the experiences of students that they go through and help them manage stress. That a link to Krista's kind of a part of the presentation on mental health disparities. And another important implication of the study is that kind of prior experience with online learning is helpful to kind of better adapt to online instruction. And if that's true, we kind of know from previous research that time management and self-regulation are important kind of skills to succeed in online environments, and universities need to recognize that and help students to develop those skills. So with that, I will conclude and be happy to have a discussion around that.
Great. Thank you very much. Questions? Well, I have a question.
Sure.
About where a student is in its trajectory in terms of your surveying 1 through 4 or 5 year students, right?
Yes, we survey all of them.
Yeah. So if they're further along, have things become easier with online learning?
That's a good question. I need to check with the data. I'm not sure it's actually true. I think it's not becoming easier in terms of the transition. And I think a factor that contributes to that is the courses they take. I think for some freshman courses are actually easier to transition to online than upper division kind of a courses, which are maybe involve more. I don't know, for different disciplines, they can involve more, I don't know, lab work or like activities that usually happen in person. So again, I need to check that. That's obviously a factor we controlled in the different models, but in terms of the relations, yeah, I need to check that.
Okay, great, thanks.
Yeah, I see in chat. It's doing
yeah.
a question, right? Yeah. Yeah, so it's actually very interesting. Like I'm thinking about this right now, that online not only limited the interaction, so like I'm pretty sure that the discussion would have been maybe more engaged during, like if we were in CSHA conference room, but at the same time there are kind of additional possibilities that online brings us, and chat is one of them. And actually students who felt that they were not comfortable speaking in person, they use that function to also to participate. Another aspect of it that I've heard from one instructor is that students who, like, it's easier to call students by names. It's easier to hear students who are not loud speakers, like who usually speak quietly, but it's easier because of the microphone. So there are some positive things that are happening online, and I'm wondering whether some of those things will stay with us going forward as well.
Igor, just picking up on that, as you were talking, really interesting data, and as you were talking, I had pulled up our report that we had done from our university on online learning versus face-to-face, because here in New Zealand, as you said, the context was very different. We were very fortunate. Our lockdown was only for 2 months, and then we were fully back on campus for second semester June last year. We've been on campus since. But in our survey, one of the questions was around preferences for online, you know, having experienced the online and face-to-face, a comparison. So looking at the data for that, asking questions in class, 59% still preferred the face-to-face, but 19% were saying actually they preferred asking questions online. And similarly, well, not similarly, interactions with classmates was the really big one that came out quite negatively for online. So only 7% like the online for interactions, whereas 78% saying either face-to-face. So I think we were asking these questions to get a sense of, you know, what will we carry on? But it is clear here at Otago, we have had a paradigm shift really in terms of the use of Zoom. We had some really interesting data from our IT department, because everyone at Otago, we're an early adopter. So all staff had accounts, all students had accounts. And prior to our lockdown, I think the Zoom engagement was something like 4,000 to 5,000 meetings a month. First part of lockdown, it jumped to 100,000 meetings a month. But after we got out of lockdown, it still remained at a really high level, about 30,000 or 40,000 meetings a month. So there has been a real shift there that people are now opting to continue using Zoom for a lot of their teaching activities.
Rachel, can you disaggregate these results in terms of student preferences by social class, or like by any measures of social class?
I think, yes, I think they can. I don't have that sitting in front of me, but a lot of the breakdowns in the survey, not necessarily social class, but ethnicity, year level of study, and so forth. We can do that.
Because what surprised me is that there are differences, kind of. So it doesn't look like for wealthy students it was kind of a good thing, but for low-income students that was kind of an important component that helped them to feel more comfortable participating in class discussions. So, and if universities care about equity, then they probably would have want to explore that further. And maybe there are studies I'm not familiar with, like about hierarchies in the class discussions and how they're structured and what groups are systematically kind of pushed out of this in-class discussions, and how online can basically help to democratize in-class discussions and engage more students. So that's an interesting question.
I mean, certainly the lower income, access to the internet was a problem in devices, but fortunately our government and the universities were very active in getting devices out to as many students as possible and installing internet in houses and so forth. So there was a concerted effort very early on to make sure people could actually all access the online learning.
Also, I'll just add on to I think what Rachel said from my experience seeing faculty adapt. The summer timing is really interesting because springtime Zoom was awful for almost everybody involved, because faculty had prepared we're all prepared in-person classes, and teaching online is an entirely different modality. And sort of anecdotally, I know from many folks across universities who effectively did whole new preps for their fall semesters that were online. The courses looked different, the syllabi looked different, the modality looked different, and so when we say online, I think online in April and online in September are just not comparable as far as experiences go. Faculty were trained up, on what to do. It wasn't just sort of one big Zoom meeting, right? There was a lot of flipped classrooms, a lot of breakouts, and use of different kinds of modalities to teach. So I wonder, all this to say, I'm very curious to see if there's sort of a spring 2021 version of SERU that's going out, what the impressions on online look like for that.
Yes, I absolutely agree that, and we see that also in the data that it's probably a learning curve. So students who already had online classes in the past, it was easier for them to adapt. So it's learning curve for students, for faculty as well. There is a survey scheduled. We have our first university will be in a couple of weeks. We have 10 universities lined up for spring survey administration this year. We have a section on remote instruction there, and we'll be able to compare whether this is true. We have a direct question whether what you're experiencing right now in terms of online is better or not. So we have a direct question, and we have also kind of indirect measures that we can compare with that survey and see whether universities are improving. My hope they are improving, and for those reasons that you outlined. But let's see if students feel the same way.
Bill, you had a question?
Yeah, may I have a question?
Go
Sure.
ahead.
Let me go first because I had my hand up. So Igor, sometimes in SERU and UQ's data, there's a kind of a Goldilocks principle involving students not working too much or not working too little, and in terms of relationship to engagement. And I wonder if there are any observations in your data about students who were working certain kinds of jobs would have been radically disrupted in the spring. Other kinds of, IT support jobs kind of more gracefully transitioned to an online environment. And then also any observations about students and working during the summer and how that could have had a lot of mixed effects to the extent you might have captured any data on that.
That's a very good question. We collect some of the data on students' work, whether their work was disrupted by kind of a furloughs, by whether they lost their positions, in the financial hardships section. So we can kind of put together, I don't have this kind of at hand. And so I won't kind of report anything right now because I just haven't seen the results yet. But this is a good, I think, area that can contribute as well to overall kind of anxiety and depression. And we know from, again, previous literature that students' financial stress is a big factor, is a big contributor. And we see from the financial hardship section that a lot of students face that. And Greg, for example, advocated for like further exploration of this topic and whether job arrangements that parents have affected that as well, whether their work transitions smoothly online or not. So we'll explore that further, definitely. I just don't have it right now to to answer your question. Any other questions, comments?
Oh,
Yeah, I have a question, Igor. You undertook this survey with, due to COVID and wanted to, understand better what was going on with students and the, the institutions, but most, the students certainly. But it was brought up earlier, how much of that survey can you find, are there correlations in earlier surveys that you've done that weren't focused like this one was? I mean, for example, all the data that Krista reported on depression and the impact on transgender special groups of students. I kept thinking, yeah, logically that makes sense. On the other hand, two things. One, how does it compare with before? Because those students are under stress for reasons that are, you know, separate from COVID as well, I think. And then how significant, how large are the numbers? What percentage of the overall student population do these groups represent? And I guess I'm saying I needed a little bit more connection to the context of the larger population.
Right. This is a great question, and trying to pull out the sample kind of a description. So this is the description of the sample that we had. Unfortunately, for undergrads, we don't have pre-measures. We don't have measures from previous years. We have those measures for grad students, and we see that the pandemic evenly increased roughly 2 times the depression and anxiety measures that we have for all across all categories, like including different, like including transgender, including cisgender. So all of the population for grad students. Again, we included these measures for 2021 survey, so we'll see whether this has changed this spring as compared with spring and summer of 2020, and see if there is a difference. Again, the measures that we report is consistent with other studies. That's what I think gives us hope that these are more or less valid measures of student mental health.
Okay, thank you.
Further questions? Anything you might want to add, Igor?
Not really. I think one of the, so Rachel, I saw your message in chat. We also, and it's interesting that we also have a comparable data from the SERU COVID survey of graduate students, and it will be great to have you presenting the results, and we can compare. Actually, Victoria University Wellington also did the COVID survey, so I'm interested how their results compared to yours in terms of doctoral students or doctoral graduates, how they compare. But in general, New Zealand, like every time I speak with people based in New Zealand, like I envy them a lot because it's so many things are go back to the way they were, and it's kind of hard to imagine from here.
I know we are very fortunate. I think for once the isolation of the country coupled with great leadership has sort of really paid off for us. So we are very fortunate. But it's tricky we've got a lot of international students still stuck overseas who can't get back here. And the government just said this week that they're not really going to open the borders this year, probably. Apart from a few pilot schemes, we are getting a few doctoral students have been given permission to come back in. So there's 250 across the country, but really we know as a country, we've got many thousand internationals overseas who can't get back to continue studies. So it's feeling for them. And also a lot of our international doctoral students here in the country, a lot of stress for them worrying about family overseas. That's quite a difficult situation for them.
Yeah.
Igor, could just take 30 seconds to give you really good kudos. I've seen lots of survey results in my days, of course. I thought the 4-quadrant chart, looking at the relationship by field of study, and obviously taking into account the extent to which coursework requires class discussion or lab or whatever, that was really breathtaking, and takes us right back to remembering we have to concentrate on field of study underlying all of this. So thank you. That was very impressive.
There are big differences by field of study, and I think faculty feels the same way. Like for some faculty, it's much easier than for others.
Sure.
Big disparities, yeah.
Yeah.
Thank
I
you.
used to
Thank you.
teach ethnic studies and cross-listed with gender studies, and our intense class discussions were so essential. I couldn't imagine transitioning to online immediately to try to do that. So,
Yeah.
yeah. Mhm.
Well, great. We've come to the end of our time, but thank you so much, Igor, and Krista also, of course, in her absence, for a really interesting study. And we'll look forward to future presentations.
Sure. Yeah. Well, again, these are the topics that we would like to explore further. Thank you so much for your comments and questions. And I will definitely present more. Yeah. Thank you, Anne, for inviting us.
Well, thank you. And just a mention that next time Zach Bleemer is going to be talking on who deserves an elite education, where he breaks down, I see Amal grinning from ear to ear about this. He breaks it down by who gets to study, where they study, tier of institution. I think it's going to be a fascinating presentation. So hopefully we'll see you all there.
Perfect.
Thank you very much. Bye-bye.
Bye.
Bye.
Bye-bye.
Bye-bye.